So the legal aspect of drug administration is there, and legally we're the ones that are to be given medications or whatever type of drugs they are, and essentially there must be prescribed or written, because you need to use that one day. It's a support, legal support, that whatever I gave, it was prescribed by somebody, and that somebody is usually the physician. Drug administration also can come in form of eye and ear irrigation, where in the ears you remove some things medicinally, or you irrigate medicinally. Either in the eye and the ear, there are also another way of giving drugs. Drugs, of course, are also given orally, that I've mentioned when I was talking about parenteral. And oral medications are also there. They are usually convenient, but with some disadvantages also. They are convenient, but with some disadvantages. The amount you are going to give orally must be, okay, drugs given orally sometimes cannot be absorbed properly, or it cannot be accurately determined that the oral one has been given properly, or the enough dosage has been given. So these are some of the disadvantages of oral medication. Oral medication also has disadvantage of that absorption may be difficult sometimes because of some diseases. We have discussed that before. Also, intravenous infusions and injections are also part of drug administration. Either you give intravenous infusion by giving IV fluids, or give IV injections by giving drugs that are in small quantity, 2 meals, 1 meal, to be given intravenously over a long period of time at intervals. Also, it's another way of giving medications. Also, it is either intravenously or intravenously or by infusion. Intravenous infusion injections have usages now. You use them for dehydrated person, which may, in serious condition, you need to give intravenous injection or infusion. In vomiting and diarrhea, there is also ways of giving intravenous injections. Serious injuries and burns are also ways where drugs are given intravenously or infusion, so that you can restore some fluid that have been lost by patients, especially during injuries or burns. After surgery also, intravenous injections or infusions are given, because some patients will stay after surgery, they'll stay unconscious for a long time, or sometimes they'll be unable to eat or drink. So for that, you give them intravenous infusions. Fluid intake and output are also important for patients, especially giving drugs, infusions or injections. Infusions, intake and output are, when they are in place, they must always be documented, and information must be shared as you are giving fluid intake, or you are assessing fluid intake and output. Whatever is taken by the patient, when you have patients on intake and output, must be recorded. Fluids that are given via the IG, via the GIT, are also recorded. Drugs given intravenously are also recorded. Excretion through stool are also recorded, and they all become part of fluid intake and output. Usages of intake and output. Number one is to determine adequate output of urine, to determine normal defecation, to assess how much fluid is taken. But all these are assessed in 24 hours. When you have fluid intake and output chart for patients, the recording must be done for 24 hours so that you determine how much patient has passed in 24 hours, how much patient has taken in 24 hours, okay? So that you assess whether there is a normal output and there's a normal intake. There are situations where, aside from intake and output, you have to also, as we talked about parenteral administration, you have to monitor intravenous infusion. And again, this is our work. In some institutions, nurses are not allowed to put IV infusions, but we monitor. We monitor infusion, we monitor the rate of infusion, we determine how long or that patient is supposed to take it, whether it is 4 hourly, 8 hourly, 12 hourly. Okay, all these are determined, okay, through prescription, through routine order. But talking about monitoring of IV infusion, this is also the responsibility of the nurse. Just like drug administration is the responsibility of the nurse, monitoring IV infusion is also our responsibility. And that responsibility is centered on maintaining flow rate, maintaining flow rate of infusion, and assuring patients' comfort and safety, okay, is the responsibility that has been assigned to us. When you hear flow rate or IV rate, it is actually drops of solution infused per minute in the chamber. You have the given set. In that chamber, fluid is dropping, okay, per drop. Is dropping by drop, of course. Now, so that drop, okay, the number of drops that is being delivered in the chamber in 1 minute is what is called IV rate, and it can be 20 drops per minute, 30 drops per minute, depending upon the order from the doctor. But in IV infusion, there's a formula to determine IV rate, and that formula, I've discussed it before, and you find it in your material, is the formula for intravenous infusion for determining IV rate. And this is the formula, is the total volume to be infused over the total time of infusion in minutes times drop factor. IV infusion formula rate is the total volume of fluid to be given to your patient over the total time of infusion in minutes times drop factor. And drop factor is that drop you'll be seeing in the chamber is what is called drop factor. And drop factor is determined by the manufacturer of the intravenous infusion. Intravenous infusion bag or bottle with the given set normally determine what we call drop factor. And so total volume to be infused times drop factor over total number of infusion per minute will give you the drop per minute. And of course, I know you know that by now, but let me just, as I've mentioned, there are factors that affect flow of infusion. there are some things that affect the flow of infusion when patient is put on IV infusion. That drop you see in the drop factor in the chamber now can be influenced by many things, and those are the things I'm going to mention now. That chamber in the giving set, after you fish it on the bag or bottle or plastic bottle, and then it is infusing, many things will determine how it is flowing, how the drop is going. There are some factors that will influence that drop to go too fast or to go too slow, and these are some of the factors. The height of the container in relation to the patient's position. The patient is lying down and the bag is too high, it will affect the drop factor. Or if the patient has high blood pressure, it will affect the IV rate. Or if the patient position, the way the patient is lying down, will also affect the patient position. The higher the bag, the faster the flow is going to be, and the sooner the infusion will finish. If the patient has high blood pressure, that pressure in the blood vessel will not allow the flow to be going properly. It will slow the flow. Or the way the patient is lying down will also affect how the flow goes. So all these are going to be properly monitored so that it doesn't affect the flow rate. In drug administration, sometimes blood transfusion is another factor that we have to look at. Sometimes blood will have to be given to patients, and it is our responsibility to monitor it, and so we have to also, it's also our responsibility, blood transfusion monitoring. And blood transfusion is the infusion of whole blood from a healthy person into a recipient vein. Assuming me, I want to give blood now, the blood will be collected by the laboratory staff from me, who is the donor now, and then it will be kept in the laboratory, and eventually the recipient will be decided whether immediately or later. So the donor is the person giving the drug, giving the blood, donating the blood, and the recipient is the one receiving the blood. We have donor, we have recipient. And there are two forms of donating blood. Blood can be donated directly, or it can be donated indirectly. And it is the indirect donation that we know all this time, but there are situations where blood will be given to patient from donor to recipient right away. After processing the person's blood group and whatever, the donor will be lying down, the recipient will be lying down, and blood will be transferred from the donor to the recipient immediately. Not from the bag, but from the donor to the recipient. Okay? And so these are the two forms. And I think I have stopped here so that our revision will continue in the next class.